and welcome to VistaTalks. I'm your host for today, Priscillia Charles, and I'm delighted to be joined in Studio 2 today by Magdalena Daccord. Hi, Magdalena.
Hello, hi, Priscilla, and thank you so much for the opportunity. Thank you for having me.
Thanks so much for being on the show. We're delighted. Magdalena is the Chief Executive at FH Europe, the European FH Patient Network. So you're very welcome, and we, without further ado, we'll get started right away to the interview. So Magdalena, first of all, for our audience who wouldn't know you well, could you tell us a little bit about yourself?
Hello, everyone. Thank you for tuning in. Once again, a great pleasure to be joining the Vistatec audience. I'm called Magdalena Daccord. It's a Swiss-French name. I'm actually Polish. As mentioned by you, I work for a patient network. It's been always my dream to work in the advocacy space. I was trying to think while preparing to this interview that I always dreamt about being an advocate and to study law, or alternatively languages. And so my dreams have come true. I advocate for people across Europe in the health space.
Fantastic. And you speak various languages, including French, I suppose, Polish, English, any other languages?
So I had Russian at school. I can sing in Russian. I speak German, and I did study Spanish, but
that's quite impressive. Yeah, that is very impressive. Not everybody can say that they've studied 5 languages. So thank you very much. So Magdalena, so moving on to your professional journey, you then took on different roles within several organizations before joining FH Europe in 2019 as their chief executive, as we mentioned. So can you tell us a little bit about the organization, FH Europe, and about your role really within the organization, please?
FH Europe, it's a European FH patient network. It's an organization that affiliates local, national patient organizations that act in the space of FH, and I will explain in a second a little bit more about the condition, or more generally heart health, or CVD, so cardiovascular diseases. FH might sound a little bit mysterious, so I will try and decipher it. It stands for Familial Hypercholesterolaemia. Every bit of the name has got a meaning. Familial means inherited, runs in the family. That's quite important when we get a chance to discuss a little bit about the condition. Hyper means extremely dangerously elevated, and cholesteremia means cholesterol in the blood. So all in all, what it means, it's a condition that runs in the families, impacts families, and it's passed on from one generation to another. And because it's elevated cholesterol, it is extremely dangerous if it's not identified quickly and treated appropriately. So far, that might sound dangerously and scary. The good news here is that the condition can be treated. There are treatments, and there are also simple lifestyle changes we can apply in to complement the treatment to live a fulfilling life.
Thank you very much. So you explained what the organization consists of and what your role is. Now, FH Europe is a registered charity, and it partners with the World Heart Federation, Global Societies, and others, among others. You recently mentioned that you wanted to build an engaged community between 24 patient networks that currently belong to the network. So I'm very interested in this network and all the different countries that that it is in. Can you expand a little bit maybe on the plans, for the organization? So I understand the organization is a network of 24 patient organizations located in 23 countries in Europe, right? And also, obviously, there is language aspect to this and importance, being in so many different countries in Europe, being an international really network.
Absolutely right. Thank you for bringing that up. I'm super proud to say that the network is the network was established in 2015, and since then it has grown, and continuously we're growing, meaning that there are still countries within the network who are happy to share their best practices, their knowledge, and support creation of patient organizations in other countries with unmet needs. As you've mentioned, we collaborate closely with 24 patient organizations across 23 countries. So we have truly from the ends of sort of, not the ends actually, from the beginning, Ireland on one side, the UK across whole Europe, and then all the way to Russia and Turkey. We've got the countries in the Nordics, so Finland, Sweden, and Norway, all the way to the south of Italy, the islands of Sicily. So that's the core countries in the network. We have recently, in July 2020, signed a partnership agreement with another organization in that space called Screen Pro FH, which affiliates countries including the Balkans, Central and Eastern, South Europe. There's also Lebanon, Iran, and other countries. So spot on in terms of the language. As an organization that should be and has got a potential to be very impactful and effective, it's important that we recognize all the languages, communication among us, and communicating our message to our stakeholders, whether on a European or local level, is extremely important. And so languages are definitely key, and that's one of the efforts moving forward to ensure that whatever messages and content we develop is available to reach people in those countries in their own languages.
Thank you very much. Yes, of course, especially for such an important message to convey to all over Europe and all over the world, really, to anyone. So thank you very much for expanding on this. So I'd like to maybe dig a little bit more into the organization, because I understand that last June 5 new trustees were appointed to the board, including Samuel Gidding, Joanna Taylor, Maris Gianta, Dorota Scotta, and Giovanni Nisato. And I was doing a bit of research, and I saw that for the organization, really having such knowledgeable, trustees joining the board really represent understanding the voices of different stakeholders in the wider ecosystem, from patient to patient organizations. You've got leaders, FH clinicians, researchers, health policymakers, industry consultants, topic matter expert, innovators, entrepreneurs. So that is fantastic to have such knowledgeable and experts in this area joining the board for the organization.
I would like to say on behalf of Reach Europe and the whole network, we are absolutely delighted and privileged to have such a diverse group of people joining the organization and bringing their skills and expertise to enhance the existing know-how on the board. As you mentioned earlier, FH Europe is a charity. We are run by the Board of Trustees. We officially have 9 trustees. The board is chaired by Jules Payne from the UK. She actually is the chief executive of Heart UK. We also have 3 other wonderful trustees among the new ones. So we've got a great treasurer, John, Gunnar from Sweden, and Inese from Latvia. So when you put all those names, all those individuals together, we have a great representation of different perspectives and stakeholders, but also languages, countries. And I must admit, we also have a gender parity on the board, which is extremely important for me. Nevertheless, what really matters here is that with their expertise, and experience, we are able to address the issue of FH and other inherited dyslipidemias that we advocate for. And I would like to take this opportunity and mention a little bit more about FH Europe as an organization and what we really do and what is our mission, why we exist. The whole idea to create that organization back in 2015 was to bring together national patient organizations and created a united one voice for a community, international community of patients and their relatives, their families, their carers. We operate in a wider space than just FH, although in our name we have familial hypercholesterolaemia. It's extremely important, and I take this opportunity to speak to the audience and people who might be tuning in. FH as a condition is extremely common. It impacts about 1 person in 250. It can be even more prevalent in some parts of the world. And the complexity of the condition is that even though it's extremely common, it's sadly unknown and as a result unidentified and undertreated.
Of course.
Because it's so common, we also have a rare form of the condition, which is called HoFH or homozygous FH, meaning when 2 people who have already the false gene get together and have an offspring, there is actually a high risk that they will have family members with children with the rare form. And the rare form is really rare. It's 1 in a million, 1 in 300,000, depending again on the location. And what is important to understand, and if there is one message I can convey in this interview, is that there's a lot of misunderstanding around cholesterol and the importance of cholesterol. Elevated level, and we're talking about extremely elevated levels in FH and HoFH, can be dangerous to your life. We have very sad and dramatic cases of young children as 4 years old dying of heart attack. We're talking about premature atherosclerosis. We're talking about premature strokes and heart attacks. So my call to you guys over there on the other side of the camera is think and ask yourself a question. Do I know my cholesterol level? Have I checked it recently? Is there a history family? Is there a history in my family of premature heart attack or stroke? Because if you're listening today and you get this message, you can actually go out and proactively do something about it, because the sooner you identify it, the sooner you speak to your doctor, the sooner you can change your lifestyle, get the treatment, and preserve so many years of your life. So I hope it wasn't overly dramatic, Priscilla, but I think it's such a wonderful opportunity.
That's an important message, absolutely. Yeah, and thank you for reminding me, for reminding everyone of the importance of checking your cholesterol and being aware that this is underlying maybe condition that you might be having from an early start in life, and that it is really important to ask yourself, have I checked it recently? So thank you so much. Unfortunately, at the moment, many of us are also currently going through a global pandemic, and I wanted to maybe discuss the actions that FH Europe has taken in relation to, in response to the COVID-19 crisis, which is still affects many of us today. I understand that the organization has actually shared a document with good practices for patient organization during the crisis. Can you tell us a little about this? I'm very curious about the document, what its content, and how we can help patient organizations.
Thank you for bringing it up. It's another very hot topic, although a lot of people might be already to a certain extent tired of listening to messages around COVID-19. I dare saying it's not over till it's over, and we still have quite a long time to go till there is a vaccine and medication available widely to everyone. So we still need to be very, very cautious. The FH community, a wider CVD, so cardiovascular disease, CVD stands for cardiovascular disease. So people impacted by those conditions are identified as high risk group should they contract the virus. So it's extremely important for them to be shielded, to be protected. And so again, quite a funny story really, because I've been appointed Chief Executive of FH Europe only in November 2019. So very new into my role. I've been facing quite a few challenges right from the beginning. I necessarily didn't have an opportunity to put like a contingency plan should there be a global pandemic. And so what we did as a network was very responsive, but hopefully quite effective. When the lockdown started impacting our community across Europe, we kicked off virtual connect calls. Basically, the idea was to understand what is happening in Italy, what is happening in France, how are people in Spain or in the UK coping, you know, how impacted are they with the lockdowns. Let's not forget, those who are identified, they have treatment, they can carry on with their life, but there's a lot of them who actually need more aggressive treatment, especially those for the rare form. Every 2 weeks, or even every week, they have to go to a special clinic and have apheresis. It's a form like a dialysis, a quite invasive, aggressive treatment to keep them alive. And so on those calls, what we realized was, first of all, there was a lot of uncertainties and a lot of unknown. The social distancing could put a lot of emotional pressure on the community.
Absolutely.
And nobody really knew how to handle the situation. So collaboratively as a community, we almost had like a pot of ideas. What can we do? Anything from sending letters to those patients that can help them go to their employer and say, hey, I'm a high risk patient, I need to stay home, to checking in with your doctors, or if they are open, how they can see patients, and speaking to the industry partners, making sure that there was enough supply of the treatment, having webinars, supporting them through updating information on the website. And as a result of that, we created really like a basic document of good practices across Europe, where every country could chip in and say, what are they doing? And that actually, interestingly enough, served as an example for other patient organizations to borrow some ideas and implement them for other communities, other patient communities. Another thing that came as a result of those calls, and I'm extremely grateful to some of the clinicians who are very supporting and supportive of the community. We put together with the experts and the patients, brief recommendations on FH patient management in the COVID pandemic. It was almost a scientific paper that was published in pharmacology research, and it's now being cited as well. So we have, as a result, a publication. And as the pandemic progressed and there was a lot more impact on the community, we started thinking about the unintended consequences of certain messages like stay home, shield, the impact of lockdown. I don't know if you noticed, but a few months down the road, there was this frightening result there were less and less heart attacks recorded across Europe and then globally, which is impossible. There is no suddenly less heart attacks. On the contrary, there probably even more. They were just going unrecorded, meaning people were so frightened of going to the hospital that very often when they had the first symptoms of a cardiac event, they would either neglect it or prolong it and wouldn't go to the hospital. And for our community, for our patient community, it's extremely frightening, risky, because they are as well as FH patients at a higher risk of suffering from a heart attack or a stroke. And so together again with the patients community, and a big thank you to the Global Heart Hub, another global patient organization, for initiating and inviting us to participate, to partner in a beautiful campaign, beautiful because it was impactful and very simple in its message. The name of the campaign, the call to action was, when your heart says so, just go. That was exactly the opposite of stay home, encouraging patients to seek immediately
medical help. Yes,
medical help. And I take this opportunity to say great thank you, big thank you to Vistatec for joining our efforts and contributing by translating the message into 14 languages in total, so we could spread the message globally.
Of course. Well, thank you very much for mentioning the initiative. Indeed, Vistatec was delighted to be able to partner with the Global Heart Hub and FH Europe in June and July for this special campaign to raise awareness of cardiovascular disease. It is so important and scary to know that anyone would be afraid really of seeking medical help for something as important as cardiovascular disease. And what does the rest of 2020 look for FH Europe? Because now that the campaign is over with the Global Heart Hub, is there any particular campaign on the horizon for FH Europe? Any initiative to continue conveying the message of seeking medical help?
Yes, we're very excited about all the upcoming events. There is still quite a lot ahead of us this year. Before I share that with the audience, I would like to highlight maybe one important learning takeaway from the Just Go campaign that helps us actually build for a better future for our community. So as devastating as the pandemic is, the shared mission of saving as many lives as possible brought multi-stakeholders, international stakeholders together. And so we were absolutely excited and really delighted to get the support and endorsement of different global and international organizations like the World Heart Federation, the European Atherosclerosis Society, the European Society of Cardiology, International Atherosclerosis Society, and the Global Alliance for Patient Access. That, for me, was a testimony that shared mission brings people together, and building those coalitions and partnerships is vital in moving the needle and improving the situation. And so, building on that success, we are now just about literally to kick off another awareness campaign. 24th of September, which is coming up very soon, is the International FH Awareness Day. And again, we are inviting the same international community, medical community, policymaker community, and most importantly, patients and their families to help us raise awareness around the condition. So please follow us, stay tuned, look out, share, and help us. I'm raising this platform. Thank you, Vistatec, for allowing the space to invite everyone to learn more about the condition. We will have different blogs, articles, podcasts and quizzes, and the next important event for us is the network annual meeting. Unfortunately, due to the pandemic and because our patient community is a high-risk community, we won't be able to do it face-to-face as planned. We will have to do it virtually. But that again allows us maybe to reach out to a greater audience in many more languages than we would normally do that. Yeah. We will be across those two events, so the Awareness Day and the network meeting, celebrating quite an important policy document that was published just before the pandemic outbreak, the Global Call to Action on FH. Back in January, the document was, the article was published in JAMA Cardiology, and we really didn't have a chance to make the most out of it and to bring it to the local policymakers. So again, with support of Vistatec, we are able to translate it into 20 languages. So in total, it will be available in 21 languages, so that we can take it to the policymakers, health authorities, and make some substantial improvements for the community.
Thank you so much. Thank you so much, Magdalena. That sounds fantastic, and we're delighted to be able to partner, with FH Europe to help convey such an important message, call to action, really, and spread the word. So, is there any plan for FH Europe to maybe expand the network as well? I was interested in knowing, with reaching out to so many different networks and countries and languages. Is there any plans on doing so for the next year or so?
As briefly mentioned, as long as the problem is not resolved, and as long as there are still countries with unmet needs, there is work to be done. And so we are hoping to bring our message and to support countries, as I said earlier, in Central and Eastern Europe, Southern Europe. There are still countries in Western Europe and in the Nordics who don't have patient organizations where the patient voice is not maybe heard. And so definitely, again, stay tuned. I don't want to maybe create premature expectations, but there's quite a lot of work to be done in expanding the network within Europe and internationally, as long as we can help.
Of course. Well, thank you so much, Magdalena. And I'm afraid it's already the end of today's show. But before we go, is there any other message or anything specific you'd like to share with our audience today?
Once again, thank you for having me today and for allowing me to share about FH Europe. My final message to everyone tuning in would be, there are about 34 million people estimated with the condition. Mm-hmm. Only 10% are identified, which means there are about 30 million of people unaware of this very silent, deadly condition. So my personal call to action to anyone tuning in today is, please have your cholesterol levels checked. Take a time and think if there is a history of high cholesterol in your family. If yes, this might be your opportunity to take action and to take care of your and your family's health. Thank you.
Thank you so much, Magdalena. Really appreciate reiterating the message and the importance of checking your cholesterol. I think I will definitely do so my next visit at the GP. That's something that stuck with me. And thank you so much for conveying this important message and all the fantastic work that FH Europe does on a daily basis. So thank you.
Thank you.
It's already the end of today's show with Magdalena Daccord, who is the Chief Executive at FH Europe, the European FH Patient Network. Please make sure to tune in again to listen or watch to our next VistaTalks show, where we'll be discussing more interesting discussions with interesting people from all around the world.